You've spent years mastering medicine, months, maybe even years, imagining how owning your own practice could change your patient care, your relationship with work, and your financial future. Maybe you dream of scheduling that allows you balance, maybe of offering services you couldn't in corporate settings, maybe of creating a culture that truly reflects your values. All of that is real, important, and powerful. And along with that dream is a new business. That comes with questions. How much will it cost? How long will it take? Who will do what workflows you'll use, what your cash flow will look like. You need to think like a business, not just a caregiver. And this is where most physicians get stopped. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and in 2025, I released Physician's Edge, the first of its kind online business education for physicians. My passion is to increase financial and business literacy for physicians. Episode 147. So you want to start a practice? Here's the playbook you can't skip. I'm so glad you've joined me for today's episode of Medical Money Matters. Picture this. You're finalizing your residency, or you've spent years in practice and you're finally ready to strike out on your own or with a small group of colleagues. You have this forward-thinking, amazing vision, a practice that reflects how you want to deliver care, a place built for patients, for community, perhaps even for innovation. It's exciting, but here's the truth. Owning your own practice isn't just about medicine, it's about running a business. And that means you need a roadmap that's complete, accurate, and realistic. That means a business plan with a financial pro forma and a timeline you can rely on. Having that plan isn't academic. It's the difference between a dream and an actual launch. With it in hand, finding a banking partner becomes a lot more straightforward. Banks want to see organization, evidence of planning, clarity around costs, revenues, how you get paid, and when you can pay them back. And because starting a medical practice is usually a once-in-a-career experience, or maybe twice at most, working with a seasoned business consultant is essential. This is your big leap. Don't just go it alone. So today we're going to walk through what you absolutely need to build into that startup plan. We'll talk through how you'll structure your entity, how you'll forecast your finances, how contracting, credentialing, human resources, and operations all fit together, and why a realistic timeline matters. And yes, there's a tool that's helped nearly 100 de novo practices get off the ground smoothly, a free startup checklist from Healthy Practices that covers it all. Let's start with why this matters so much. You've spent years mastering medicine, months, maybe even years, imagining how owning your own practice could change your patient care, your relationship with work, and your financial future. Maybe you dream of scheduling that allows you balance, maybe of offering services you couldn't in corporate settings, maybe of creating a culture that truly reflects your values. All of that is real, important, and powerful. And along with that dream is a new business. That comes with questions. How much will it cost? How long will it take? Who will do what workflows you'll use, what your cash flow will look like. You need to think like a business, not just a caregiver. And this is where most physicians get stopped. And this is where the business plan comes in. It's your roadmap. And it needs to be more than a summary. It has to be a real plan with assumptions, numbers, and timelines. Think of it this way. You need to define your mission and vision. What kind of practice are you building? Where? What patient population will you serve? Which services will you provide? And then support that with data. What's the demand like locally? Who are your competitors? What is your competitive edge? Then, importantly, a financial pro forma. How much does setting up cost? Lead, build out, equipment, IT, staffing, supplies? And how much revenue will you generate in month 1, month 6, year 1, year 2? When do you reach break even? And how much cash do you need to get there? When you can answer those questions in a thoughtful, documented way, you're no longer a hopeful solo practitioner. You become a viable candidate for financing. Let's talk about financing for a moment. It's true, banks are generally willing to lend to medical professionals. Why? Because they know clinics can generate steady cash flow, especially if you have payer contracts and expect solid patient volume. But they want to see rigor, a budget, pro forma, timeline, collateral or equity, and a repayment plan. You're not just asking for money, you're presenting a business. They want to evaluate it, understand the risks, see that you've structured things responsibly. They'll look at upfront costs, lease or build out, equipment and supplies, staffing, EHR, marketing, and what your anticipated revenue will be and how you will service a loan. Too many wannabe founders hop in without that detail, and banks that can provide the capital needed to bridge the gap from opening to revenue decide not to take the risk. A solid plan de-risks your project in their eyes. Because this, starting your own practice, is incredibly important and rarely repeated, working with an experienced medical business consultant, like Healthy Practices, dramatically raises the odds of success. This is not something you do every year. Maybe you do it twice if you're changing locations or opening another site, but it doesn't happen often. You're not deep in the daily complexity of startups. You might not know what lease provisions matter most, how to budget for credentialing delays, how to structure the org chart, or how to organize billing functions. A consultant brings perspective, and I like to say that our clients get to benefit from our prior mistakes. We've seen what works, what stalls, what prompts delays, and what scares payers. We can help you avoid costly missteps, align your plan with healthcare realities, and save you time, stress, and capital. Now, let's unpack the key areas your startup plan must cover. We'll track through each piece. Imagine we're walking through the steps together. First, governance. What legal entity will you use? Are you sole proprietor, professional corporation, limited liability company, or a group practice partnership? How will ownership work? Who's on the board? Who votes? How decisions are made? What happens if someone leaves? You'll need bylaws or an operating agreement that spell out governance structure, decision rights, and dispute resolution. These aren't electives. They determine how you operate and how you protect yourself in the long term. Next, financing. Beyond the plan and the pro forma, think through the details. How do you set up banking and accounting? Will you use a medical-specific chart of accounts, an outsourced bookkeeper, or seek out a manager who can handle some of the financial tasks? What's your billing and collection strategy? Will you bill in-house or will you outsource? How do you manage claim denials? What are your projected days in accounts receivable? How will you manage cash? What financial controls will you have? Approval thresholds, reconciliations, expense policies. All of this is necessary to prevent embezzlement. You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. Contracting and credentialing. This is one of the biggest timing pitfalls. Payer contracting takes months, from enrollment to contract negotiation to credentialing to fee schedules and payer portal access. It's not unusual for a provider to be all ready to see patients, but they can't bill yet because the credentialing and contracting takes so much time. That means having a financial runway and planning that phase carefully. Your startup plan needs timelines, responsible parties, and contingencies for delays. Human resources. Practice is nothing without staff. Who do you need? Front desk, medical assistants, nurse biller, office manager, and when? Recruiting healthcare staff takes time. You need job descriptions, interview processes, offer letters, onboarding training, payroll and benefits setup, human resources compliance. Healthcare has employment rules, OSHA requirements, possibly union rules depending on your location. Getting the team in place early, trained, and aligned is a cornerstone of your launch. Operations. This is your daily workflow. How does a patient move from phone call to appointment to rooming to documentation to billing? What scheduling systems? Will you use a call center or will you have that in office? Which EHR will you use? What hardware do you need? What type of connectivity will you want for your office? Where do you store records and how do you manage telehealth? What policies do you need for HIPAA, OSHA, infection control, emergency response? What's your process for supplies, equipment, maintenance, cleaning, and patient feedback? Operational clarity equals smoother, safer, more efficient workflows. Every one of these areas is on our free startup checklist. It's not generic. It's been used in nearly 100 de novo practice startups over the years. It draws on real experience, common stumbling blocks, and best practices. Download it early, use it as a framework, run through it with your consultant. It's the difference between saying, I think I've covered everything, and I know I've covered everything. Of course, none of this matters unless you have a timeline, and it needs to be realistic. Most practices take 9 to 12 months from decision to first patient walk-in. Here's how that might look. Months 1 to 2, refine your business plan, engage your consultant, secure your office site. Months 2 to 4, execute your lease or build-out, register the entity, apply for financing. Months 3 through 6, buy equipment, hire staff, set up your EHR and your workflows. Month 4 through 8, contract and credential. Month 6 through 10, begin marketing and outreach. Month 9 or 10, soft open. Month 12, open with full operations. Build in buffers. Delays happen in permitting, credentialing, hiring, construction, and equipment delivery. The plan is both your engine and your brakes. It keeps you moving, and it pulls you back from an overreach. Let me share a couple of stories with you. One practice wanted to open in 9 months. They had a space, a physician, and an idea. They forgot to budget for billing system setup and hired staff too late, so when credentialing ran long, they had no one to run claims. Their cash ran tight. A minor consulting intervention, adding staffing buffers, padding the timeline a bit, and focusing the priority on credentialing first, got them launched by month 11, which was 2 months later than they'd hoped, but with a lot less financial stress. Another practice had carved out excellent workflows and governance, but assumed credentialing would happen in 2 months. 2 of their payers took 4 months. Without a financing plan, they burned through savings, which created a great deal of financial stress. The consultant helped renegotiate landlord payments, extend temp staffing, and delayed supply purchases. Bottom line, planning plus contingency equals resilience. For you listening, what I'd encourage is this. Start now on the business plan. Sketch your mission, your market, your numbers. Don't wait until money is needed. Even if you're 12 months or more out, begin with the checklist, map your timeline backward. If you're 6 months away, run a gap analysis. What are you missing? If you're 3 months out, your plan is your lifeline. Engage a consultant, not for an audit, but as a partner. They're your shortcut, your sanity check, your early warning alarm, and your continuity plan. As we wrap, here's what I want you to remember. Creating your medical practice is both profoundly rewarding and deeply complex. Thinking you can do it without the business support, financing plan, or operational clarity sets you up for stress or even failure. But a thoughtful business plan with a robust financial pro forma and a realistic timeline opens doors. Literally, it opens the doors to banker financing, to credentialing, to your front desk going live on schedule, to patients walking in on time. So make that plan. Include governance, finance, contracting and credentialing, human resources, and operations. Use our checklist. Partner with professionals. Give this project the respect it deserves. It may be one of the most meaningful decisions of your career. If you'd like that free startup checklist from Healthy Practices, which has guided nearly 100 successful openings, visit our site after the show. Download it. It's yours to shape into your roadmap. And if you're anywhere from exploring to executing, reach out. We will always take a meeting gratis, whether you're thinking and planning or getting ready to open your doors. Thank you for joining me today on Medical Money Matters. Your dream of building a practice that reflects your values, your care, your expertise, it's real-lifeable. With clarity, planning, partnership, and a bit of grit, it's not only possible, it's something you can succeed at. Until next time. Thanks for listening to today's episode of the Medical Money Matters podcast. If you're ready to sharpen your financial skills and take control of your practice's success, it's time to check out our online course, Physician's Edge, Mastering Business Finance in Your Medical Practice. This isn't just a course, it's your blueprint to mastering the business side of medicine. Learn to navigate budgets, maximize revenue, and make confident financial decisions that drive your practice forward. We call it the Mini MBA for Physicians. All and only what you need to run your practice confidently. And you can earn 25 hours of CME in the process. Don't just practice medicine, master the business of it. Visit healtheps.com/physicians-edge to learn more and start building your edge today. See you next time on the Medical Money Matters podcast, where your success is our mission.